First, let me tell you that venoactive drugs can benefit patients in all stages of chronic venous disease. That is, in all clinical SEEP classes. Venoactive drugs have a multiplicity of actions, such as, first, they increase venous tone so that some valves that are leaky can become competent. They also reduce inflammation, they increase lymphatic drainage, and they reduce capillary leakage. Some venoactive drugs have many such actions, and others have less, so their actions on different symptoms vary. Their clinical effects are mainly to relieve symptoms, reduce edema, slow down disease progression, reverse skin changes, and promote the healing of leg ulcers. Because of their variable actions, their efficacy on symptoms, skin changes, etc., vary from drug to drug. Because symptoms are subjective, the efficacy of venoactive drugs needs to be evaluated using placebo-controlled, blind, randomized controlled trials. In the past, several meta-analyses combined randomized controlled trials of several drugs evaluating their effect on one symptom or the global effect of one drug on several symptoms. Because the effect of a drug could be strong on one symptom but poor on another symptom, the net effect came out as moderate or inconclusive. However, recent meta-analyses, such as the ones done by Professor Alert or Professor Kakos, studied the efficacy of one drug at a time on each symptom. The result was that we had a clearer picture. Here is an example of the effect of a drug on pain. As you can see, it is very effective. Here is an example on the effect on the feeling of swelling. What was remarkable from this type of meta-analysis is that the number needed to treat was very small. As a result, in the international guidelines, which were published in International Geology in 2018, we were able to produce a table for the strength of the evidence for each drug on each symptom, each sign, healing of leg ulcers, and even quality of life. In the presence of 2 or more randomized controlled trials, we gave a grade A, and in the presence of only one randomized controlled trial, we gave a grade B. This table provides the clinician the ability to choose the right drug depending on the symptoms or pathology present. We did the same for the healing of leg ulcers. Finally, here is the table on the strength of the recommendations based on efficacy versus side effects. As I said at the beginning, venoactive drugs can be used in all stages of SEEP. For C0S, because venoactive drugs are very effective, and because currently this is the only choice we have, for patients with varicose veins who do not want an operation, and even during or after operation, if symptoms persist, for patients with edema, such as we have in the post-thrombotic syndrome, and finally, as an adjunct to compression for the rapid healing of leg ulcers.